Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Thank you so much for tuning in today for this episode of Being Well. I'm your host, Keanne Armstrong. And today we're talking about skin. This is something that we all have and we're all interested in. And this is a perfect time of year to start talking about it. Today joining me is Angela Hamilton, and she is a family nurse practitioner with Paris Community Hospital. Thanks so much for joining me today.
Thank you.
So we're talking about the skin today, and something that is so important to so many people is skin cancer. Do I have it? How do I prevent it? Let's start talking about that.
It is an important subject. 1 in 5 get a skin cancer throughout their lifetime, so it affects a lot of people. So there are many different kinds of skin cancer, but the 4 that I see the most, number 1 is a precancer. It's called actinic keratosis. It's abbreviated for AK if you've seen that around, but it is precancers, and they usually come in the sun areas, so on the face, the nose, the neckline, sometimes the chest, hands and arms. They're red and they're scaly. Sometimes it feels like they have a little, I don't know if you've ever remember the old fiberglass insulation, but how that kind of stuck you and it kind of felt like a little tinge that way. They feel like that, and if you scratch it, it may come off, but it may come back. So those are precancers called actinic keratosis.
Okay.
The second kind, which is actually the most common skin cancer, is basal cell carcinoma. They are more like a papule or a bump, and they are real shiny around the edges. Sometimes they'll ulcerate in the middle, and they have little blood vessels going through them, so you can see little red blood vessels going through the lesion. The thing about those is they don't heal, so people will get a spot maybe on their nose or their ear, and they'll scratch it, or they'll see, or they'll wash with a washcloth and it will bleed. Mm-hmm. So then the next day it will heal, and then 2 days later the same thing. So if you've had something like that over 2 months, we probably need to see it. Those are the most common. The second most common, and on the basal cells, they don't usually metastasize. They usually are a disfiguring type of skin cancer. So maybe they'll not get a big area on your nose or something like that, but they usually don't go inside the body. Okay. So they don't metastasize. The squamous cell carcinoma are the second most common skin cancer, and they do metastasize sometimes. So we're a little bit more concerned about getting them taken care of early. And they are more of a red, scaly, scabby looking lesion. So they still have the red tinge, and they're scaly and scabby. And again, they don't heal. So that's really key, is if it's growing faster than you, of course, like the basal cells now, or the squamous cells as well, and if they're not healing. Some of the squamous cells can come up in a couple weeks, and they look almost like a little volcano on your skin. So that's a concerning lesion, and of course, for a lot of people, that's scary when they come up so quick. And again, they're usually in the sun area, so a lot of times on the hands, the arms, the face, that sort of thing. I also, depending on what people do, so if you have someone who's working outside with their shirt off, then I might see them a lot on the back. If I have maybe females that wear shorts a lot, then I may see them on the lower legs as well. So any of these lesions are basically wherever you get the skin cancer. Years ago, and even some today, we've seen some yesterday in some of the patients, it was males were on the right side because they drove all the time, and then females were on the right side because they were the passengers. That's not so true anymore, right? Because we females drive a lot more.
We have lots of places to go.
That's right, but it was that way in the past, and we can see these lesions on any age group. group. So the third one is the deadly one that is really scary, and that's called a malignant melanoma. And one person dies every 54 seconds from a malignant melanoma.
Oh my goodness.
So that's pretty concerning. If you have over 5 sunburns in your lifetime, that increases your chance of getting a melanoma by 2 times. So that's in one of those prevention things that we say. We always want you to wear sunscreen. Now, melanomas are different than the other two. They can be just about anywhere. So they could be in your nail bed, they can be in your mouth, they can be in your eyes, they can be anywhere on your skin. It doesn't have to just be the sun areas. So that's kind of concerning for people too. They can be between your toes, and people don't look there, so they're a little more dangerous there because you don't look. So that's the other kind of skin cancer. Now, what they look like are more of a mole that is changed or gotten dark or sometimes gotten clear in the center or around the edges. So the edges are not the same, and they're not all perfectly round. They're all different borders. So also then the color changes. And we also say anything over the size of a pencil eraser is something that we need to be concerned about. So if you have a mole or a spot that is bigger than that or gets bigger than that, then we need to know. These are the ones that when I told you that anything that changes in a 2-month period, these are the ones that I would worry about being a melanoma.
Okay. And then when you say that they change in color, do they start off lighter and turn darker, or what should people look for?
It actually depends. So some of them will start off just a kind of a tanny brown, and then they'll actually get really dark and maybe even almost a black color.
Okay.
And some of them will get a red purple in them, and some of them will even get a clear and a white area in them. So it kind of depends. It could be any of them. So if it's over that size and changing at all, you just need to have your physician look at that.
Okay, so of those 4 different ones that you just described, does it go in stages up to the melanoma, or are they separate?
Usually it is more of a stage thing. It doesn't just appear all of a sudden, but it can do that too. So it could be either way. But for the most part, you'll see a mole and it's changing, but you can continue to get new moles throughout your lifetime. So those moles could just come up and be dysplastic, atypical, or even turn into a malignant melanoma.
Okay, so we hear a lot if you're fair skin, you need to be more careful out in the sun and different things like this. Does it matter if you're fair skinned, if you have darker skin, what color your hair is, what color your eyes are? How does that play into this?
It makes a big difference. So someone like me with red hair and blue eyes, I have a higher chance of getting skin cancer than like my husband who has brown hair and brown eyes. If he has olive skin compared to my really pale skin, then I'm going to probably get more sunburn, so I'm going to have a more chance of getting a skin cancer. Any color of skin should be protected with sunscreen, and that's going to be your number one defense. Sunscreen or clothes that have sunscreen in them. They have hats now with sunscreen in it. Also make sure your sunglasses are UVA, UVB protective, not just one or the other.
Okay.
That's important. And remember, if you are maybe someone who drives a lot and you need to have the UVA, UVB protection on your windows, then it's usually a clear coat, not necessarily the tinting. People think the tinting is the protection, and truly it's not. It's a clear coat of UVA and UVB protection. Now the tinting may have that in it,
Right.
but the truth is you don't really need the tinting, you need the UVA and UVB protection.
Okay, and while we're talking about sunscreen, does it matter what the number is? The higher the number, the better, or is there a number where it's like, okay, this is as much sunscreen protection as you're going to get?
That's a good question. I hear that a lot, and the higher the number, the better it is. And I did the test on myself because I like to make sure that I'm not just getting a lot of information that's wrong. And you can use a 30 and then go on up on your arm and use even 100, and the difference is huge. So a 30 is what I suggest for everyday use. So if you have it in your makeup, then you should be putting it on a 30. Some people can just use. Also, there's a lot of really good day creams, which all have usually a sunscreen of around a 30 in there. So you can use those if you don't use makeup. People can use just a cream. And for males, there's a lot of new products out there, aftershaves and stuff like that with sunscreen in it. So 30 for every day. But if you're going to the lake, or you're going to Florida or Mexico or somewhere where the sun's a lot more intense, you want to get up in that 70 to 100 range. But if you're maybe right here in the Midwest and you're just going out to the park, 50 to 70 is probably going to be okay. The thing about it is it depends on what you're doing. So if you're going to go to the beach, you need to get the water resistant.
Yes.
And on the water resistance, on the sunscreen bottle, it will tell you the water resistant, if it is or isn't, and it also will tell you whether you can put it on wet or dry, and it will tell you how long it's good for. So it may say 80 minutes, then you need to reapply in 80 minutes. But if you're wet and you reapply, you need to reapply with one that is good for wet skin.
Okay. And what about kids? Do we need to use sunscreen that's just for kids, or can they use any kind of sunscreen?
They can use any kind of sunscreen. The thing with the sunscreen for just for kids, it has a little less burning effect, maybe, but other than that, it's the same as the other sunscreen. Look at the ingredients, because sometimes they just put baby on there, and there's no difference between the baby and the adult. So look at the ingredients and see if there is a difference. Anyone that is younger than 6 months shouldn't be in the sun, period. They should have hat covered up, stay in the shade, and not be in the sun. If they are 6 months and older, then you can use sunscreen on them. But again, you do need to reapply.
Okay.
And for all the people out there that, I don't want the chemical on my child, I don't want to use anything like that, then there are natural things you can use, like zinc. Zinc oxide's natural, you can use that, and then you don't have so much of a chemical type product on your skin. So there's other ways to get around it. The other thing that I like to see on children, have you seen the shirts that are water shirts?
Yes.
So they're actually look like a swimsuit, but yet they go down,
Right.
And those are wonderful for kids.
Yeah, rash guard, I believe. They're like surfers.
Yes, they look like surfer shirts. That's what I always told my kids, that they were surfer shirts, because then they thought they were cool.
Yeah, my son wears that. So
Yes.
okay, good.
Yes.
I'm doing the right thing
Yes,
there. Yeah.
especially on the shoulders, because they get hit a lot by the sun.
Yes.
So even if they have it to here, I'm happy. But, of course, it's always better to go all the way.
Okay, so let's go back and talk about some of these different things. If people notice something on their skin, what's the first step that they should do?
So first step is to watch it. If it grows within 2 months or changes, then you need to let someone know. If it is bleeding and not healing, or you scratch it off and it comes back, those are all things that you should go to your primary care for.
And do you need a referral to see a dermatologist? Is that a specialized?
It depends on your insurance, but 99% of them now do not have to have that. And it also depends on the dermatology department. So to come and see me, you don't have to have a referral unless you have a certain insurance, and then that insurance requires it, not me. Does that make sense? But some dermatology departments require you to go through your primary care first and then come and see, depending on what the issue is.
Okay. I wanted to know about treatment. So it can be scary if you have something you're thinking, how is this going to get removed? What do I do about it? So talk to me about the treatment that is available for all of these different things that you've mentioned.
So if you have a skin cancer or a suspicious lesion, you would come to my office and we would look at it. Sometimes we take pictures of it, especially if we're going to do a biopsy. So then the next step would be to do, if I believe that it needs to be taken care of, then we do a biopsy. And depending on what the lesion is, we'll do a shave biopsy. So we'll just take a little shave of that area. Another biopsy we do is a punch biopsy, where we take actually a little sort of a cookie cutter of the skin area, which is much better for melanoma and those sort of things. Also depends on where the lesion is, how we biopsy it. But those are two ways that we biopsy most of ours. So after the biopsy, then we send it to the lab, and it's usually a lab that's specific for dermatology, and they look at it and then they'll send it back to us. And once it gets back to us, it says it's basal cell or squamous cell or malignant melanoma. Then we have to make a decision on where and what we're going to do. So if it is a small lesion and it's under maybe a centimeter, we may take care of it there in the office. If it's a larger lesion and maybe on the face, then we may send it to a Mohs surgeon and have it taken care of there. If it's something that's specific or maybe on a different part of the body like the heel, we may have to send it to plastic surgery. So it kind of depends on what it is. If it's in the hair, sometimes I need them to have radiation on it, so they'll have to go to radiation therapy. So it kind of depends on what kind. We do have, for the precancers that I talked about, the actinic keratosis, we have a chemo type cream that we use. Okay. So they may use the cream for so long. We have a couple different ways that we use it.
Okay. Now, how does a person prepare for the appointment? Because, I'm sure they're nervous, and you say it's just skin. What walk somebody through what will happen?
So when you come into my office, or probably just about any dermatology office, you will, of course, we'll get all your history, and we'll want to know if you have had skin cancer. We'll want to know how many burns you've had. We want to know what type of skin. Are you the redhead, blue-eyed, or are you the olive skin, brown-haired person? We want to know what medications you're on, because that makes a difference in a lot of things. We'll want to know all of your history as well. And then after we take your history, then I'll come in and do a actually head-to-toe exam. And I even look at your hair. So I'll part your hair and look in your hair, and I'll ask you, has your beautician said anything about in your hair or any spots? And then I'll actually ask you to take off your glasses, and I'll feel your face, because sometimes I can feel them before I see them. And then I'll ask you to come in without makeup on, and you can bring your makeup and put it on afterwards, just in case. So then we'll look at your face, and then we go over, and everyone is different. Some people like to keep a gown on because they don't like to get naked. But in order to do a good skin exam, you have to get naked. So then I may start at the top, and I'll ask you to take off your shirt and your top, and then we'll go through that. Then you can put that back on. Then we'll go through your legs, and then you can put that back on. And then we'll sit down and we'll take off your shoes, and we'll look at your feet, between your toes, bottom of your feet. Even genitals, people don't like to say that word, but that's another place that we have to look. It's skin. Right. So be prepared to get naked if you come into the dermatology
Good to
office.
know. Well, it might be a little shocking, but it's all skin, right?
Right, it's all skin.
It's all skin. So let's talk about some different things that you see on skin besides skin cancer as well. What other things do you educate people about?
So I had a little lady one time, and she says, Angie, the older I get, the more stuff grows on me, and that's true. So that's a lot of the things that I see. So lenticos are one of the things that I see, and you probably heard grandma say, oh, that's just a liver spot. Mm-hmm. They're the dark spots that come maybe on the sun areas, your hands and your arms, and anywhere that's been exposed to the sun. So they are just flat and smooth, and they're usually brown colors, so that's why they call them liver spots. They're nothing to worry about, but we do watch them for change. So if they do get bigger, or they get different colors in them, or they get darker, then we would want to see those. And then the second one, which are really more aggravating than anything, are seborrheic keratosis. And they are similar to a lentigo, but they are thicker and scalier, and they go in the areas that get a lot of friction. So you might see them around people's necks, around the bra line, the waistline, and also where they've had sun. So maybe on the temples or areas like that. Okay. But they're thick and they're scaly, and people like to scratch them off, and they scratch them off, and they still come back.
Right, okay.
So there's more than that. The hemangiomas, which are, I don't know if you've ever seen those, but they're like little tiny blood blisters. And a lot of people get them as they get older, and they can be purple or blue as well. But they're basically tiny blood vessels that come up to the surface, because as you know, when we get older, our skin thins. Yes. And when our skin thins and we lose our estrogen or testosterone or whatever it may be, then you might get more blood vessels to the surface, and you'll be able to see more things on your skin than you did before.
Okay. What about people who may have itchy or dry skin? What do you recommend for that?
So, as I've told everyone, and you've probably heard this, your skin's your raincoat. Mm-hmm. You need to keep it moist. So if you laid your raincoat out in the sun, it would get dry and cracked, and it would let bacteria in, and it would let fungus in, and all of those things. So you have to protect that. The skin's the biggest organ in the body, and sometimes we forget that it's an organ and that we need to take care of it. So like you brush your teeth, you need to wash your face, you need to wash your skin. Now, you can wash it too often too, so you don't want to wash all the oils and all of the protective mechanisms off. So be careful of that, because a lot of people have a lot of issues where they wash their hands too much, especially people in the medical field or the dental field or the fields where they have to wash their hands a lot. So be careful with that. But how I like to tell people to take care of them is to use creams. In the hierarchy of lotions and potions that people put on their skin, lotion is mostly water. Then you have cream that's a thicker base that does a lot better job, and then you have the Vaselines or the ointments, and those are the ones that are greasy and sticky, and people really don't like to use those. Right. So use the creams. They're the best for your money, and there are many brands of creams out there that are really good.
Okay. Now, also around this time of year, a lot of people don't just like to be out in the sun, but they like to go camping, they like to go hiking, all these different outdoor activities. What about using sprays on your skin or different things for to keep the pests away? away?
So that's a really good point, because that's huge in this area right now. There's a lot of Lyme's disease, Rocky Mountain spotted fever. There's all kinds of different things that you can get from mosquitoes, from ticks, from all kinds of different insects. So that's important to keep protection from those. The best thing to use is a DEET. There are other things that you can use, and I'm sure you've heard of Buggins and Bug this and Bug that. Yes. Some of those work, and they have the different scents and the smells, and they work a little bit better to me for like the buffalo gnats and those things. But when you're talking about ticks and mosquitoes, you really need the DEET. And some people are like, I don't want to put that on my children. Well, if you look at the CDC website, they talk about, they do a good job of helping us and protecting us. If you look at their website, other than if you were allergic to it, or if you had some sort of open area, you should be fine with using a DEET. And remember on the DEET, because it's never really been fully explained everywhere, the number on the DEET, so if you go buy a can and it says that it's DEET 25, and then you see right next to it there's a DEET 30, what that means is it's going to last longer. So the higher the number, the longer it's going to last.
Oh, okay.
Not that it's more effective.
Right.
It's just going to last you longer.
Okay, that's good to know. So it's different than sunscreen.
Yes, it's different than sunscreen. So if you're going to go out on a hike and you're going to be out there 4 or 5 hours, maybe you should use the higher strength.
All right.
Or not strength, the higher number.
Right.
Really.
So it stays on longer.
Right.
Okay, let's talk about shingles. We had mentioned that a little bit before this production, and that's something that a lot of people struggle with. So tell me about that a little bit.
So shingles is a type of herpes virus, and it is can be very dangerous, but the biggest thing is it's very painful. So it usually goes in a dermatome, a nerve root type thing, so it's usually on one side or the other. So if you would get it, for instance, in this dermatome that goes up the side of your nose and to your eye, you're in danger of harming your eye. So that one is one that, because the nerve that goes to your eye could be affected, that we need to see right away. A lot of people will get them on the mid-back, and it will be a dermatome across, and sometimes 2 dermatomes, but usually it's only one. It's only on one side. So you can kind of think about, if you've only got a rash on one side, what could it be? If it hurts, you need to make sure you talk to your doctor right away. The faster you get on the medication for the shingles or the herpes zoster, whatever you want to call it, then that is better for you for the cure, or for the actually maybe not getting it as bad. So if you would take the medicine the first day that you feel the pain in the blisters, then it's going to help you rather than you taking it on the 5th day. Does that make sense?
Yeah.
So you won't get it as much or as hard. So that's important, because it can be very painful. I've got patients that have had it 6-7 years and they still have got the pain. They don't have the rash any longer, but they have the extreme pain. So that's an issue.
Yeah.
So we want to prevent that, and we can prevent that by taking the medicine. You can also take the vaccination. So if you take the vaccination, you may still get it, but you won't get it as bad. So that's really important for, especially, the elderly population, that this could be very painful for.
Okay. Well, we only have a minute or 2 left, and there's so many different things that you can talk about when it comes to dermatology, but let's answer one last question here about bruising on the skin. What do you educate people about when it comes to bruising?
So the biggest thing, as we get older, again, we lose that layer, so then you bruise easier. You tap it, the dog jumps on your arm and you get bruises. So the biggest thing is keeping your skin healthy. So use the moisturizers and keep it healthy so that it doesn't tear and bruise as much.
Okay, and is that go the same for younger kids versus older people as well? Is it the same?
It's the same for everyone as far as basic skin care, but as far as the bruising, that usually develops as we get older more. So no matter what, just to recap, you need to protect your skin. You protect your skin by keeping it moist and healthy, sunscreens, DEET, or some sort of bug repellent, and also being preventative and having at least once a year a skin exam. I always tell everyone to look at their birthday suit on their birthday and look at it from head to toe. So that's another thing that you can kind of remember, and then make sure that you go to someone and get examined, and that they get you naked, because that's important. We have to see all of your skin. So growing faster than you, not healing, and changing in 2 months are the 3 things that you need to look for in lesions, just to recap.
All right, that's great information. Thank you so much for joining us today.
Thank you for having me.
And thank you so much for watching this episode of Being Well. We hope that you learned a lot about the skin, so take care of it. Thank you so much for watching.
Production of Being Well is made possible in part by
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.